My name's Courtney Barton. I'm 37 and I live in Salem. Came in because I had some like severe nausea, vomiting kind of thing. It was uncontrollable for like 24 hours. It was really bad. It was really bad. I actually work in the ED in registration. So we actually went to the walk-in clinic first, and the doctor over there was like, listen, I don't think this is just like a flu bug or something. Like, I honestly feel like something is really wrong. Like, please go to the ER. I didn't know how busy we are. I didn't want to come in here just for nausea, you know, like I know there are serious cases. And so the pain just kept, my whole stomach was hurting the whole time. And so like she talked us into going in, and I remember we walked in and it was, you know, people I work with, and they looked at me and they're like, get her back there now. Like, something's wrong. They put me in a room, and the nurses were coming in, and the techs, and everyone was super nice. No one recognized me. I had a ball cap on, so like some of them didn't know who I was. So it was kind of funny. But I had Dr. Hutchison was my physician that day, and he came in, and you know, he was really attentive, listened. But I actually had several experiences. That was the first time. I was probably in the ER like 5 or 6 times throughout the month of October, September, October, for the same issue. We did CT scans. When they did that, they found a small bowel obstruction. And so I actually ended up being admitted to med oncology on the 3rd floor for like 3 days. And so that they'd found the obstruction and some large cysts on my ovaries that they were concerned might be cancer. So I was up there. I had Dr. Guecko was my main doctor on the floor, and then I met with Dr. Voigt and an oncologist kind of were trying to figure out a plan to take care of everything at one time. And so yeah, he really, you know, like took concern to talk to me and talk to my husband, and you know, really let us know what was going on. And they ended up having to do like an NG tube, and so he came in and explained what that was going to be like. I mean, it really just walked through. And even like I did have to have surgery, and so like Dr. Voigt came in, you know, like, and explained everything to us. We had several visits with him before the surgery, and even after my surgery, he came in and made sure that I was okay. And when Dr. Voigt went in, because he was so concerned with them, he actually like went up and like took pictures and measurements and all that while he was fixing the bowel obstruction, so that the oncologist, and I see a fertility specialist in Columbia too, so everybody that was taking care of that side would have what they need as well. Like, he went above and beyond what he needed to do. I see the back end side of it, and how like those nurses never sat down. Like, they're always running. And so to know like when I came in that like my care was just like, they took such good care of me, you know, it was just, I wanted to make sure that people knew that, you know, we have great nurses here and they really do care about the patients.